Ear infections are one of the most common illnesses in young children. More than 80% of children will have an ear infection before they turn 3. For many children, an infection will clear up on its own or with the help of an antibiotic. But repeated infections can damage the eardrum, and persistent fluid in the middle ear can cause hearing loss. When that occurs, we consider a different treatment approach.
In some children, based on their anatomy, based on their immune system, they might get more than the usual number of ear infections. In those cases, we usually will send the child to an ENT, an ear, nose, and throat doctor, to decide whether the child might need myringotomy tubes, also known as ventilation tubes.
These tubes might be recommended in a number of scenarios. If a child has fluid in their ears for 3 or 4 months after an ear infection, if fluid causes hearing loss, or if fluid causes a delay in speaking. Tubes are also recommended if a child has repeat ear infections that do not improve with antibiotics, or if an ear infection is severe enough to change the structure of the eardrum. The average age for ear tubes is between 1 to 3 years old. Tube placement is often a 15-minute procedure performed as an outpatient surgery.
So what myringotomy tubes are is that the ENT will put a very small tube, it looks like a tiny little straw, through the eardrum. When the ear infection is starting to develop, fluid accumulates behind the eardrum in the middle ear. And instead of growing and growing and growing in the amount of fluid and pressure behind the ear, the fluid simply will exit through the tube and drain out into the outer ear. So when your child has tubes about to get an ear infection, you might notice that the fluid is coming out of the ear and the child will have a little bit of discharge in the ear. And that's perfect because that's the tubes working.
Goodbye fluid and goodbye problems. Tubes reduce the risk of future ear infections. Surgery immediately resolves any hearing loss that was caused by persistent middle ear fluid. Children who had speech, learning, or balance difficulties will see an improvement within several weeks. And without continuous infection, your child will feel better, sleep better, and be a happier person, and that will make all parents sigh with relief.
Tubes will often fall out within a year or 2 of being placed. In rare occasions, the ENT has to go back in and remove the tubes.
But wait, you shout, I just got my happy toddler back. Won't the removal of the tubes make the ear infections return? For some children, yes. About 30% of children have the tubes reinserted within 5 years. For others, time and physical development will resolve the issue.
As your child gets older, the eustachian tubes, which are the natural anatomical way that your ear drains into your nose and throat, become more and more vertical. When you're a baby, they're more horizontal, not allowing for the fluid to use gravity to drain out. As you get older, it becomes more vertical, and the fluid will naturally drain out of the ears.
By then, you may have aged into a whole new ear battle, turning down the volume on those headphones. We worked so hard to preserve your hearing through the ear infections, let's keep it through the earbud phase. I'm Dr. Daniel Applebaum, and you're watching the eHealth Network. See you next time.